I would like to welcome everyone to Hudson High School and thank Town Manager Paul Blazer, Superintendent of Schools Kevin Lyons, School Committee Chair Chris Yates, Principal John Staplefield, as well as Police Chief Richard Brega for their assistance in organizing this event. Congressman Tsongas would like to give special thanks to the River Edge players who graciously rescheduled their rehearsal this evening to allow for this important discussion. First, we have this space from 5 to 7 p.m. Please be respectful of our host and leave when our time is over. Second, with the large number of attendees who wish to ask questions and allow Congresswoman Tsongas to respond, I would ask everyone to be respectful of your fellow citizens, the diverse opinions in this auditorium, and the democratic process. While asking questions, Congresswoman Tsongas respectfully requests that everyone be as concise with their questions as possible. 2 microphones are set up in the aisles, and questions will be taken alternating from aisle to aisle. Please limit your question to 1 to 2 minutes to allow for the largest number of attendees to have their opportunities to address the Congresswoman. Congresswoman Tsongas will open the town hall by speaking for a few minutes about the current health care proposal. She will then open up the question and answer portion of the program. Congresswoman Tsongas is in her second term. She currently serves on 3 committees: Budget, Armed Services, and Natural Resources, and has taken this effort to reach out to as many citizens as possible during this national debate. Please welcome Congresswoman Niki Tsongas.
Thank you all. It's great to be here. Great to see a very committed and passionate group of constituents who care so much about this issue. We all know you are not alone, that there are many across this country engaged in very serious debate about what is the appropriate next step forward for this country. This is my sixth healthcare-related forum. In Washington for 2 weeks, because we are pretty much captive of the legislative agenda there. We had to spend most of the week in Washington, but healthcare coming front and center. I felt it was very important to reach out to my constituents, and I used modern technology to do that, having 4 telephone town halls. I don't know if any of you participated, but it's a remarkable way for me to connect with all of you, talk to you about what we're doing in Washington, and get your feedback. We did it in such a way that we broke the district down into 4 pieces. We did Greater Lowell, we did Lawrence, Methuen, Haverhill, and Andover. We did Lowell proper because it's the largest community, and then we did all the towns of the southern part of the district. It was a remarkable process for me. I was able to answer a lot of questions for those who stayed on the phone. We had thousands of people participate. I've also, since being elected, initiated something called Congress on Your Corner, in which, since I was elected, on any given Saturday, I will go to a supermarket in our district. We'll select a town. We'll robocall the community and let people know that I'm there, and then people can come down for a couple of hours and talk to me about what's on their mind. If there's something in particular that my staff can help with around Social Security, Veterans Affairs, Medicaid, Medicare, whatever it is that relates to the federal government. As a result, we've been able to help thousands of people, but also, again, another way for me to connect. Last Saturday, we had scheduled a Congress on Your Corner at Market Basket in Chelmsford, and obviously the outpouring of interest was too great. And I have to give Market Basket great credit and thank them for being so welcoming to me and my staff over time. And we held a town hall in Chelmsford, a town hall instead in Chelmsford in the adjoining gymnasium to the town hall. Tonight was also supposed to be a Congress on Your Corner at Market here in Hudson, but obviously, again, given the great interest in healthcare, we felt it was appropriate to do a more traditional town hall session. So why are we here at this moment? I think it's a confluence of a lot of things, but primarily it is the unsustainable cost of doing nothing that forces us to think very carefully as a nation as to what is our next step forward. We've all read the figures. If we don't do anything, the escalating cost of health insurance will be unsupportable for an individual, very difficult and challenging for an employer, whoever it may be, and a very great challenge to government, as we do pay, and we are the provider of care, of insurance care through Medicare and Medicaid. And also, as a member of the Armed Services Committee, I do hear from our military about the rising cost of health insurance issues for covering those who serve in our military. And I travel across this district, we hear it from municipalities, we all know it as we watch town budgets, trying to wrestle with all the great things that government needs to provide, and the great challenge of continuing to provide affordable health insurance for employees across the board. So that is number one. If we do nothing, it could be that within 10 years, $1 out of $5 of everything we produce as a nation will go into health insurance. If we do nothing, 1 out of 5 employers may well be forced to drop their health insurance coverage for their employees. That is the world in which we operate. This is an issue that has been on our agenda for many, many years. In my telephone town hall that I did in Lawrence, a gentleman stayed on the line. He identified himself as someone who was 85 years old. He had campaigned for Truman on the issue of national health insurance. So this is an issue that has been very much one that we have tried to deal with as a nation for many, many years. When my husband, Paul Tsongas, was a candidate for the United States Senate in 1978, the dominant issue, one of the major issues we talked about, was health insurance for Americans. With President Clinton, you saw an effort to try to wrestle with this and deal with it. It wasn't successful. But in the meantime, the challenge of the issue has simply grown. And each of our major candidates, Senator McCain and Senator Obama, now President Obama, agreed that the issue of health insurance was one, and health care was one that we needed to deal with as a nation. Since President Obama was inaugurated, since the beginning of this term of Congress, over 60 hearings have been held on this issue. Just to give you a sense of, it's a highly complicated issue, but it's made more complicated by the fact that in the House of Representatives, 3 committees are dealing with it. Ways and Means, which deals largely with the financing, Energy and Commerce, and Education and Labor. On the Senate side, 2 committees are dealing with it. The Finance Committee and the Health Committee, which is Senator Kennedy's committee, which sadly he is not running at this point because of his grave health issues. So 5 committees dealing with this. 3 in the House have reported out their piece of it. And that was the great delay in Congress, in the House, getting the Energy and Commerce Committee to come to some agreement in order to reap their piece of the legislation out. Next steps are those 3 pieces have to be blended in something called the Rules Committee, and once blended, it will come to the floor of the House, possibly this fall, for a vote. On the Senate side, the Health Committee, Senator Kennedy's committee, has reported out their part, but the Finance Committee, Senator Baucus's committee, has yet to come to any agreement as to how to pay for what is being proposed. So a lot of moving parts create a lot of confusion and a lot of concerns that I feel it's very important as a member of Congress to try to address and explain as best I can. This dynamic is laid on top of the fact that we have a very complicated system. It's a uniquely American system in which roughly 60% of Americans get their health insurance through their employer. I, as a member of Congress, am one of those people. I am an employee of the federal government, and I have access to a health insurance plan that is similar to what people in the post office get, people who work for the National Institute of Health get, people who work in federal prisons get. That is the health insurance plan that I make my choice from, but it is an employer-based health insurance program. Then you have government programs such as Medicaid and Medicare that deliver services to seniors and those who meet certain poverty guidelines. So those are government-run programs that provide government-run insurance programs that provide health insurance to millions of Americans. Then we have people who also get their health insurance through the Veterans Administration. but they also get much of their care through the VA. It's really a standalone situation. This legislation does not affect the VA at all. And then we have the great challenge, and to go backwards, within the employer-based insurance, we are essentially choosing from private insurance companies. Either your employer negotiates with your insurance companies, then gives you a choice that you can choose from, or sometimes no choice. Your employer pays roughly 2/3 of your insurance premium. You pay possibly 1/3 of it. Often that's a subject of negotiation and change, a very dynamic one, because as cost of health insurance goes up, it becomes an issue for employers as much as it is for each one of you who has to pay your part of it. This is true in Medicare too. The rising cost, not so much the rising cost of insurance, but the rising cost of care is a great challenge to the federal government as we go forward and try to address and maintain one of the most important social safety net programs in this country. And then we have the great challenge of those who are uninsured, primarily either because they simply cannot afford it. In Massachusetts, we've tried to address that with the Connector program that essentially subsidizes the purchase of health insurance for people so that they too can be covered as they seek medical care. And then we obviously have those who are self-employed or small businesses who need access to something like a connector, which is essentially the pooling mechanism to have a choice of affordable health insurance policies. So it's a highly complicated situation, uniquely American, and as we've tried to craft an insurance reform to this great uniquely American plan, if we can call it a plan, we've done a number of things. One, we're trying to address the issue of the affordability of health insurance in general, and the underlying issue there is the cost of care. Because while insurance companies do make exorbitant profits, nevertheless, it cannot be divorced from the fact that as a nation, we do pay an awful lot for the medical care we receive. We are trying to create access for those to health insurance, for those who can't afford it, through affordability credits, which functions much like our Connector program, or for a small business or a self-insured individual, access to what we call the exchange. Here it's called the Connector. People can go in, make a choice of public insurance plans, private insurance plans that work best for them, but provide private insurance coverage for their health care. In the course of this, we've also introduced the notion of the public option. And the public option is one more choice. It is not a mandate to anybody. It is simply a government-run insurance program that will compete on a level playing field with the private insurance programs and give people choice. The value of choice, in this state, we have more choices than many parts of this country. But as I've learned, what I have learned is as I've had to familiarize myself with all these most important issues, there are parts of this country that have virtually no choice. You can come from a small state in which 2 private insurance plans are all you have, and they essentially have a monopoly. Which side of the coin do I choose? They're essentially the same. A public option, hopefully, will provide an affordable alternative and create competition, but also add choice. So that is the important issue around a public option, that it simply is not a mandated choice, it's just something else that's out there. A lot of the discussion has been around how to structure that public option, and the consensus is that it should operate on a level playing field, be funded by premiums. The premiums are, if you choose, if that's the insurance plan you want, you say, that's what I'm going to pay for every month, and that's the insurance plan that's going to cover me when I go to the hospital. But the success of that option is very dependent upon physicians being willing to provide services through it, be reimbursed by it, but also each one of you choosing it or not. And if you don't like it, it isn't going to be successful. So those are roughly some of the issues that we're to deal with out there. The underlying issue of the affordability of care, we see a lot of evidence that the fee-for-service system that we have built our reimbursement system on, in which we essentially pay a physician every time we go to have some sort of treatment, really drives overuse of the system. So while there's not enough evidence to say we absolutely have to change the fee-for-service model, there is enough evidence to say we need to start experimenting with it. So the public option might be a place where we start to really look at ways in which we reimburse physicians for our services. If it doesn't work, then that's just an experiment that we put aside. But we have to have some place where we start to do pilot programs that really do begin to better understand what drives the cost of care. You hear a lot about comparative effectiveness research. That's simply a data-gathering entity that brings in all the information around a particular disease, the different ways in which it's been cared for, the different kinds of medications that are used, the different kinds of procedures that might be used to address it, and then compare the data. It does not mandate a choice. The information will be available to physicians as well as to patients, so the patient and the doctor can work together to decide what is the best course of treatment. Over all of this is significant insurance reform. In Massachusetts, we are fortunate that we cannot be excluded for a pre-existing condition. So if you lose your job, you're forced to seek out a different form of insurance, no longer through your employer. You cannot go, when you go to an insurance company, they cannot say, we won't take you because you have a heart problem, or we won't take you because you were treated with cancer. We are fortunate in Massachusetts. That is not the case across this country. There are other insurance reforms that are very important. Insurance companies can and often do put a lifetime cap on what they're willing to pay for your health care. That will no longer be allowed. Insurance companies can no longer put a cap on what we were going to put it, often you'll have health insurance, but there are co-pays and deductibles that you have to pay in spite of your health care. There will be a $10,000 cap on what your annual out-of-pocket expenses will be, particularly important if you are faced with a catastrophic illness in 1 year. 60% of the bankruptcies in this country take place because of, before we had the great challenge in our housing market, take place because of medical issues. So these reforms will go a long way to obviate some of the most unfortunate practices of the insurance industry. People say, well, how will they afford it? They will afford it because there is an individual mandate which says everybody in this country has to have insurance coverage over a certain age. And that's for the 47 million uninsured, that's 47 million new potential customers for the insurance industry. And many of them are actually quite well. All of us know we have all of our young people, we hopefully are well. They do not need tremendous, hopefully any real significant care in their early years, but they are going to be required to buy health insurance. On the other hand, because I know this question might come up, there also is a provision that our children can stay on a child can stay on a family's health insurance plan until they're 26. And that gets them through those years in which often they tend to drop coverage and be uncovered. On the other hand, if they choose to have insurance, and they can go into, if their employer doesn't provide it, they can go into an exchange where there will be hopefully many affordable options that they can choose from to give them the coverage that they need. So this is the rough outline of what we're discussing in Washington. It's a lot of moving parts. To suggest that it is done or that the final piece of legislation is done is quite erroneous, given the dynamics of the committees, given that once the House passes a bill, the Senate passes a bill, the two have got to come together, and you'll end up with yet a third possibility that will come back to each body of the Congress to vote on. So it's very much a piece of legislation in progress, and which is why I think it's so important to hold these kinds of meetings, hear your questions, try to answer your concerns as best I can. But I have to say that from my point of view, I always keep in mind the unsustainable cost of doing nothing, and the fact that we have a moment in time where we have some hope of addressing this, and that if we fail to do it, the long-term cost, not only to each one of you, but to our economy, will be a great one, because more and more dollars generated by everybody's hard work are going to go into healthcare and healthcare issues. So let me stop at that and open it up to questions.